there's a lot of loneliness that goes on because there's that judgment that happens because of one's age or, who they are, et cetera. And we see that across the board, just with humans, unfortunately not being humans.
Yeah.
So from the perspective with seniors, it's like, how do you outreach? How do you get them more involved?
Hello, welcome. It's so good to see you. I love starting these conversations first and foremost with an icebreaker. Favorite movie? A movie that has some profound interest for you, something that you still remember to this day. It could be something from 30 years ago or maybe 3 days ago. I'll start with you, Dawn.
Well, my favorite movie is Gone with the Wind.
Of course, that's a classic.
Yeah, so much that I just named my car Scarlett O'Hara because I got a red car, and so I've decided to
name it
the car.
Something
Scarlett.
tells me you're not the only one. Something tells me, and that Scarlett, your car, is probably not the only car out there named Scarlett.
Could be, right?
Come on,
hopefully.
I mean, it's got a little personality, a little something. I got it.
Yeah, for me, it's one of the movies that it's a show on Netflix
that
I saw recently. It's The Club. Yeah. It talks about 40, 50 years ago's Turkey, some of the things that have been going there. Yeah.
I want to go back for a second. Hakan, I'll start with you. Why does that speak to you, that series or that movie?
I like real life stories, just what people have gone through, how they dealt with it. So there have been a lot of really good personal stories there.
Yeah, something you can relate to?
Yes.
Yeah. Dawn, I want to go back. In Scarlett, why is that movie so profound for you?
So the movie brings a lot of memories. So as a child, we used to watch it every year, and it's just a lot of history, and it's just one of my mother's favorite movies, and just became mine as well.
The reason why I bring up the icebreaker, because it's a very nice, I look at life almost like an onion, where there's different layers, and usually a book or a movie or a childhood experience really does inspire you for the work that you do when you grow up, if you will. So fast forward to now, you both are co-workers, you both are doing some impactful work. Walk me through your roles. Dawn, let me start with you.
So I run our markets for our organization as the president for the company, and I also am the CEO of the health plan, and primarily responsible for just a number of things within the company, but anything that represents the health plan is my accountability. Been doing this for quite some time. Love the senior market. It's just a passion that I have. My grandparents died at a young age, so I always wanted that opportunity to work with older adults, and now I'm getting to that point myself, so I'll be working with myself.
Okay.
Yeah, I'm Chief Technology and Experience Officer. I'm mainly responsible for data technology, AI teams, as well as our customer service, Medicare Stars quality teams.
Yeah? I'm going to be a little bit make a controversial statement, although I don't believe the statement that I'm going to make, and that is that seniors in technology are like oil and vinegar. I think that used to be the case. I think that used to be kind of the stigma, if you will. But if you fast forward to today, most seniors, first of all, they're younger seniors, if you will, because they're living longer, but they've kind of grown up with technology in many ways, very proficient with a smart device or what have you on Instagram and other social media. But why is this still a stigma? Assuming that I'm right with this prejudicial statement that I just made.
It's interesting because it and I think it's the fastest growing population in this segment. A lot of seniors have iPads. A lot of people you text. There are, of course, courses that we will do as an organization to educate to how do you communicate with your grandchild, among other things. And it is the continuous feedback. Well, seniors are probably not on text or they're not on a computer, and it really is. Seniors today are very different than they were 20 years ago, and so we've got to grow up into that phase.
Is it fair to say that the grandparents of yesterday are not the grandparents of today? That's how I would phrase it in many ways. To your point, in my earlier point, seniors are pretty with it. They understand technology. Now, having said that, technology is changing so quickly. I think the question is how quickly seniors are catching up.
Yeah, I think for that it's mainly us changing as well and our perceptions.
Yeah.
At the end of the day, for me, it is just we cannot just enforce somebody to use a technology. They should get some value out of it. Just there should be a win-win situation, especially when we look at even senior care. Okay, we would like them to use technology, but what are they going to get out of it? Just how are we going to make it much easier for them? Many times, okay, we are thinking seniors are difficult or they really, but when we spend the time, when we show them, for example, during COVID time, what we did, we sent many seniors cell phones or iPads to be able to do virtual visits. Maybe first a couple visits, they required some assistance, they needed some help, but after a while, yeah, they know how to do it. They love it. I think just it is mainly there are things we can do as well to make it easier for them. And really, that is what we are trying to do at Alignment.
Let's expand on that a little bit, Hakan. Would you make the argument that that was impactful for you to see, my words, not yours, the transformational change that seniors made during COVID with technology?
Absolutely. It forced everybody. I think it forced seniors to seek different ways, but it forced us as well to do something for seniors, just to go above and beyond, to push our boundaries. I think it forced everybody.
And how did that make you feel?
It made me feel great.
Yeah. Dawn?
I love the question and I love the conversation. It's interesting. So COVID actually, it changed more of, I think, the industry than it did the consumer directly. We would institute town hall meetings because we were prioritizing, the highest risk member that we can identify through our technology on how we can get food to them, how we can get even something as simple as a mask. I mean, and at that point in time, a mask really wasn't simple. It was very hard to get, so we had masks made. But we would conduct virtual town hall meetings to talk and ask and have question and answer sessions with clinicians, et cetera. And we would have 11,000 seniors participate. And they were really ahead of what they believe could help than even some of the clinicians we were inviting to that conversation. But, that technology became it was more for us than it was for them. And the other piece too is, when you think about technology, it's really kind of behind the scenes. It's like, get to know me better. How do you know me as an individual? We can be more proactive in those conversations with our consumers, just in general, whether senior or non-senior. And so the technology is pretty powerful when you think about utilizing it in the right way.
What are some of the biggest misconceptions that you think we all have about seniors, and how do you think we should address that?
Yeah, great question. I think sometimes, for example, we feel like I hear this a lot, or it might be a user error. For example, we have misconceptions about, seniors are not really able to use the technology well. But in reality, when we look at, did we design the technology for them? Did we make it easy to use for them? Did we create just user guides, or did we train them? I think we have some gaps there. But really, at the end of the day, when we show them, we are there to try to help them. And if we are able to get their feedback in a constructive manner, I think it will make it better for everybody. It helps us to make our products better, and it helps seniors to get what they need from us.
Dawn, your point of view on this?
Well, I just, I think when you think of somebody that's older, they've been through life.
Yeah.
And they've actually have, so much to teach all of us.
That's right.
Although I'm getting close again to that senior stage.
Let's be clear. You're probably maybe pushing 40, okay?
No, thank
you're
you.
pushing
Thank
40.
You. So I'm trying to reverse that age. But it really is, I've learned so much from people that are older, even when I was in my early 20s, and the wisdom and the experiences in life and the lessons learned. And some of that, I wish there was opportunity that I would have even listened more at that point in time because of that. So it's not that, people are, less, experienced or talented, or in fact, they're more. And so because they've made it.
Yeah.
If you think about it, a lot of people don't even make it to certain age
Yeah.
groups, right? And they've made it, and they're living life.
Yeah. And they're just learning a different way.
Right. Now, the pieces that I see that, we want to do a lot more is there's a lot of loneliness that goes on because there's there's that judgment that happens because of one's age or, who they are, et cetera. We see that across the board, just with humans, unfortunately not being humans.
Yeah.
So from the perspective with seniors, it's like how do you outreach? How do you get them more involved?
Yeah.
And so we do a lot of work through our technology to say, are they living alone? Have you been outside? What do you do for your activities? How can we help? Or how do you create these clubs to get them more involved? And then teach our folks that are answering the phones, getting them more. We're forming a lot of different committees and we're inviting them. And it's just such a great experience to see former CIOs of banking industries or, getting involved in committees. Now they're negotiating dollars at this point in time, but they want to get involved and they want to, help the younger generation, which is great.
What I'm hearing Dawn say, Hakan, is like building community and that connectivity in many ways. Is that what you're hearing as well?
Yes, exactly.
So there's some really, really impactful things that are happening. Dawn, let me turn to you to see if there's like a specific example that really does warm your heart.
Well, most recently, so my mother has been in a skilled nursing facility because she had a fall, and she actually loves the facility that she's in. However, every time I go and visit, you see an environment that needs so much improvement and so much work. So most recently, I asked the facility, can I bring my dog? I have a Sheepadoodle and I have a Westie and a mini pin. And so I brought the Sheepadoodle and the Westie in, and I decided to go visit patients inside each of their rooms. And it just was such a beautiful experience to see the happy, like the smiles, because people, they didn't have visitors, but with that dog, our dog coming in and just, can I touch your dog? Like, please, please. And just, almost even to a point of begging and just the smile and just, thank you so much, including the staff. It was just such a beautiful experience. And it's just, looking at that, I was thinking, gosh, we need to do more of that. How do we write letters specifically to all the patients that are sitting into our skilled nursing facilities that may not have a loved one that's visiting them or doing a visiting program? And, because we know that the value of what we're seeing, that what's happening in these skilled nursing facilities are not at the level that anyone would expect it should be for, what's happening in that environment. So
I remember a few years ago, Medicare Advantage was this small little baby that was a project for the federal government, and it really was just kind of like this extra little thing. Fast forward to today, that baby is now a grown adult that is mature and really popular with seniors in terms of the choices, in terms of the flexibility, in terms of the cost. From your perspective, first of all, am I right? And also from your perspective, how are you seeing it on the ground?
Well, since you said I'm 40, I think I started at 7. I've been doing this about 33 years. And, it's just evolved. But, it's interesting, the likes and wants and needs of that consumer, there's a lot of similarities. However, it's evolved. And the more that we can talk about it and get the message out that it really is a fantastic program, the more you'll see that growth. And that growth rate is exceptional. It's continuing to grow. I think a lot of us, when we think about the cost of healthcare today, prior to that 65th birthday when you get Medicare, it is really a challenge when you look at the rates and you look at what the coverage is. So coverage, even though there's coverage that's available for the uninsured, that cost of healthcare is crazy when you think about it. And I talk to people too often, they'll say that they don't have that coverage as a result of it, and they're waiting till that 65th birthday. So a lot of people can't wait. We, of course, are a growing industry, and so we're all trying to be as creative as possible in that journey, but seniors like it, and they're growing.
Why do you think they like it? My earlier point around flexibility and choice, is it that or something else?
A lot of delivery systems are participating as a part of it, so the choice of the doctor, choice of benefit options, the competitiveness were related to the premium and the cost of care, co-insurances, it's the value is great. There still is a supplemental market, but MA is definitely outgrowing.
Hakan, we reached 30 million people, and it's still growing, seniors that have signed up for the program. From your perspective, what do you think is the sweet sauce, or the secret sauce, if you will, about Medicare Advantage?
I think being more consumer-centric and really taking care of senior. Just the health insurance industry is evolving. Maybe you gave the example maybe 20, 30 years ago. It was more like business transactions or an administrative function to administer the claim, manage the membership. But today when we look at it, Don mentioned about supplemental benefits or really just doing the full care coordination for the member. Just from a couple weeks ago, a new member who recently joined to Alignment. Yeah, prior to joining Alignment, she was having transportation issues to her dialysis appointment. Then she joined us. I realized, okay, first a couple appointments with us as well. Just the driver was canceling the appointment. Just then we reached out, we figured out it's a rural area, just not much transportation companies. We found actually a local company we contracted with, and we took care of her. And after a couple weeks, she called me crying. She said, okay, for the first time, she was able to sleep with peace of mind, thinking next morning she will be able to make her appointment.
Oh, wow.
So as a health insurer, our only obligation is not paying the claim for a dialysis appointment, but making sure that really happens, really make it happen for different diverse population. I think that is where the real power comes.
100%.
Don and team, with their innovation around all these benefits, make it more personal, really making sure every senior gets the care that they deserve, not only from payment side, but make sure it happens. I think that is the real power.
You know, that's interesting. That kind of warms my heart in many ways because it's a real story around a real person. And, folks that work with me have heard me say this a million times now, and that is it's a real deep relationship, a meaningful relationship. It's not just about, to your point, Hakan, around just paying the bill. It's about making sure that person's okay, about getting to their dialysis appointment. And she was able to sleep that night.
Yes.
That's a really powerful story. So thanks for sharing. Sure. Dawn, I want to talk for a few moments about the next chapter in Alignment Health. What does that look like from your perspective?
It's our goal to make sure that we grow beyond certain markets. So we're in 6 states today. We'd like to go across the country, or enable other payers to do what we do. As Hakan said it so eloquently, we do more than just pay that claim.
Yeah.
We actually have a full clinical model. We actually have clinicians that go to the home for home care for patients that are homebound or need more, special attention. So, the journey is to just spread the news, to get the message about what we do to more seniors across the country. I think when people hear about it and they enroll, then the experience, is very rewarding, but it's getting that message out.
Hakan, would you like to share anything on that note?
Yeah, I think just our mission is to Dan's point, right? We have built, I think, a unique high-touch, high-tech experience. And yeah, we would love to bring it to every senior in the country.
Mm-hmm. Yeah. I love to end on this question, and that is the next big thing in health is?
Yeah, I think leveraging more and more AI. I think it's going to really help reduce the burden on clinicians. They are still, unfortunately, spending a lot of time on documentations, on different things, just pulling data. We really would like them to focus on the patient, and I think AI is going to help us a lot. And even some other technologies with the telehealth, with other things, unfortunately for many specialists today, you might need to wait 2 months, 3 months just to get an appointment. So definitely I think there are so many things that we can see just to make that access to care much better through technology.
Thanks for sharing. Dawn?
Of course, I love all these questions. But, I think that the next big thing in health, there's so many things that I think about, but I'm trying to narrow it to one.
Give us 2 or 3 if you want.
So the one would be I really do believe that we're going to get to a place where we're going to pay claims through a credit card.
Okay.
So I think that to get real-time, immediate payment as well as connection
and also flexibility perhaps for the patient. There's a lot of reasons why they put on their credit card. It could be for their points. It could be for whatever reson. Yeah.
Correct. And and us even honoring, or organizations honoring that card specifically so that you can pay the tracking and the documentation around that can't get any better than that. The other piece is I think it's going to be around Part D. So for pharma. So there's, there's a lot of discussions about, you hear about it, Ozempic, Mounjaro, and others, when you see the demand in that space, or you see the demand in areas like whether it's drugs and or chat GPT, it's like, how do you embrace that and make that a part of what your journey is?
Yeah.
We're already doing that with technology. We've been ahead of it real time. So it's not a year old. It's like here and now for the technology piece. But the piece specifically around the drugs, like how do you embrace that? But make sure that you have a true care or coordinated health program journey to support if people want to embrace those types of drugs for, weight management, et cetera. Because we have a lot of diabetics that are in our company and our plan. And separate of that, but how do you embrace that to offer that to your seniors?
To be determined. I look forward to having you back on sooner rather than later, where we can unpack this a little bit more, especially around AI. And then the question becomes the privacy guardrails around that, and how do we, as a society, feel about some type of algorithm maybe making some decisions for us that a human used to make. But the flip side to that, to your point around the human being free to make much more informed decisions that is more patient-centric.
Exactly.
To be determined.
Yeah.
Hakan and Dawn, thank you very much for joining us. Really appreciate it.
Thank you. Thanks.